One of the common questions which I get asked is there a permanent cure for diabetes, or is there any cure which is likely to come in the near future? If you want me to answer in one sentence, as I am speaking to you today, there is no proven permanent cure for your diabetes. In other words, you will have to do three things: keep dieting, keep doing exercise, and keep taking your regular medications. When you are doing this, how do you know that your diabetes is under control? So the first question we asked ourselves, is diabetes a curable disease? And the short answer was no, it is not a curable disease. So you can control diabetes at the best, but you can never cure it. Having accepted that, you should know what do you mean by control. This is something which I want all of you to understand, because either you are a diabetic or you have a diabetic patient at home, and unless you have this understanding, you will be only having a lot of confusion. When you have your dinner, sleep and get up, you check your blood sugar. We call it as fasting blood sugar. You should not take even a glass of water or coffee or tea or any breakfast before you give this sample. So it must be absolutely fasting. That fasting blood sugar should be around 110 milligrams per deciliter. If it is beyond 130 milligrams per deciliter, if you are on medicines, those medicines need to be revised. So first, fasting blood sugar should be around 110 milligrams per deciliter. Second, when we say diabetes is under control, the parameter what we use is called postprandial blood sugar or post-lunch blood sugar. 2 hours after your lunch, your blood sugar values should be under 160 milligrams per deciliter. So if your sugar values are 200 or 300, it is grossly abnormal and you must revise your medications. Third, every third month, you please go to the nearest pathological laboratory and get your HbA1c levels checked. This is also called glycosylated hemoglobin or glycated hemoglobin, and those values should be around 7% or less. Three things I told you: fasting blood sugar not more than 110 milligrams per deciliter, post-lunch blood sugar not more than 160 milligrams per deciliter, and HbA1c not more than 7%. The other thing which we need to remember in patients who have diabetes is their LDL cholesterol levels. Total cholesterol should be definitely less than 200, maybe around 160 milligrams per deciliter. But the most important thing for all of you to understand and remember is your LDL cholesterol should not be more than 70 milligrams per deciliter. And if you were to have a problem with your coronary arteries in the past, that means if a doctor told you that there are blocks in your heart and you already had an angioplasty or stenting or an operation, your LDL cholesterol levels are better be around 50 milligrams per deciliter or even lower. So if you control these 4 parameters, your diabetes is under control. So if you know what do you understand by diabetes control, you will know that you will have to just focus on these 4 values. One is cholesterol, LDL, and the other are related to your sugar. If you take care of these things, you will be happy and healthy. Stay happy and stay healthy. Eat less, exercise more.